Thank you all for joining. Is this typical? Today we are going to be talking about your child's development from birth to 6 months old. And really quick, before we get started, we're going to do some introductions. So my name is Brandy Plass. I am a physical therapist, and I have been working with the clinic for 6.5 years.
And I'm Liz Guprode. I'm an occupational therapist at Cleveland Clinic Children's in Medina, and I've been with the clinic for 10 years.
And I'm Hope Super. I'm a speech language pathologist at Cleveland Clinic, and I've been with the clinic for 6 years.
Okay, we will get started here. So really quick, before we get started, I just want to kind of review that we're going to be talking about typical developmental milestones between birth and 6 months old. But we just want you all to remember that these are guidelines, they're not hard limits. So some kids may achieve these skills a little bit sooner than the age ranges that we're talking about, and some may take a little bit longer. But we'll talk about different red flags during each section and when you should talk to your pediatrician if you have any concerns. So safe sleep, we're just going to review what the American Academy of Pediatric recommends, and that is that babies should always sleep alone on their back and in a crib. And this is to help reduce sudden infant death syndrome. So to review that a little bit further, so when we talk about babies sleeping alone, that means that they can share the room with a caregiver, but they should never share the same bed. You can place the crib near the caregiver's bed. And you also want to keep the room free of smoke and pollutants, and you don't want to overheat or over chill the room. When we talk about babies sleeping on their back, we always want to place the babies down to sleep on their backs when they're sleeping and napping. And a way to help prevent flat spots on their heads is to alternate which side you put the baby down in the crib or bassinet each night. So maybe on one night you put their head on the left side of the crib, and the next night you put it on the right side. This way you're alternating, so when the baby wakes up, they're equally turning their heads both ways. And then the C in ABCs is placing the baby in a crib or a bassinet. This refers to a firm, flat surface, and we want to keep the crib or bassinet empty, free of all blankets, pillows, toys, and bumper pads. You can use a tight-fitting sheet, and a way to keep your baby warm is using a sleep sack instead of a blanket. And also regarding safe sleep, it's a good reminder to know that once the baby's able to start rolling over by themselves, and this can be typically between 4 to 7 months old, it's okay to let them choose their sleeping position, but you want to remember you always put them down to sleep on their backs, but if they roll over by themselves, that's okay. And you want to stop swaddling the baby as soon as they show any signs of trying to roll, and that can be as early as 2 months old. So to start our gross motor section, so this is referring to our physical therapy section. What do physical therapists do with little babies? We look at their body posture. What do they look like when we place them on their backs, on their bellies, on their side in a supported sitting position? We look at their head control. How are they actively moving in their environment? We're assessing their strength, their range of motion, and their muscle tone. Do they have symmetrical skills and movement patterns? And are they achieving their gross motor skills on time? So positions for babies. We want to make sure that baby spends equal amounts of time in all different positions. So this refers to placing them on their back, on their belly, on their side, and a supported sitting position. So there's multiple pictures on this page that show different variations of how to position your baby throughout the day. It's just a good reminder to vary it up. We don't want too much of one position and not enough of the others. Positioning for head shape. So babies' heads are moldable in that first year of life. And because the bones in their skulls are soft and not totally fused together just yet, it's really important to change baby's position because their head can actually flatten if they're getting too much time in one position on the back. So this is why tummy time is very important and why we want to place babies in different positions such as that sideline, supported sitting, and tummy time. This is going to help prevent flat spots on their heads and help promote overall gross motor skills. So what is considered tummy time? So tummy time, we are referring to any time that baby is awake and alert and that they're placed on their belly. So this could include flat on the floor, chest to chest with a caregiver, inclined over a boppy pillow or towel roll, or over the caregiver's lap. Our goal with tummy time is by the time they are 4 months old, the baby can tolerate about 60 minutes of tummy time a day. And this can be broken up throughout the day into small bouts. A good reminder is to try a few minutes after every diaper change and to just incorporate it into your daily routine. The more frequently you're offering tummy time, even if it's for short bursts of time, the easier the baby will tolerate tummy time and get stronger in that position. So why is tummy time important? Tummy time is really important because it's going to help develop their motor skills and help keep them on track developmentally to achieve their milestones on time. It helps strengthen their neck, their shoulders, their back, and their core. And it also is important because it can help prevent those flat spots from developing on the back of their head. So what do you do if your baby does not like tummy time? This is a question we get a lot as physical therapists. And what we always recommend is so you put your baby down on their belly, once they start to fuss, we want to try to distract them and keep them calm. You can try talking to them, singing to them, distract them with a new toy. If they're still fussing, after about a minute or so, we're going to roll them over onto their back, calm them down, and then put them back on their belly again. That way they're learning, hey, mom or dad or my caregiver is there to help me, but I have to go back on my tummy. And another couple tips here, and there's some nice pictures on the bottom. So some tips to help your baby tolerate tummy time better is making sure their arms are tucked underneath their body. This allows them to lift their head up higher and for longer periods of time if they have those forearms underneath them. You can also try incline tummy time for improved tolerance. So the picture there that shows the baby propped up over the boppy pillow is a really great one, or even doing chest to chest on you is a great one. And you want to try to wait until after they're fed. So give them a little bit of time after you fed them. So if they do have some reflux or upset stomach, we don't want to put them right on their belly right away after they've taken a bottle or nurse. So give them at least like 20 minutes or so and then try it. Another frequent question we get as physical therapists are all about positioning devices or containers. So the best place for your baby is on the floor. But we know that, sometimes we need a safe place to put your baby if you need to go to the bathroom or take a shower. So if you are going to use any positioning devices, we recommend that you limit that time to 15 to 20 minutes maximum. And every time if you are using a device, you follow it up with some floor play. So putting them down on their bellies or backs so that they can move freely. Floor time is best because it helps promote independent mobility. It helps promote core, arm, and leg strength, and it helps promote that motor planning. And it's going to help your baby achieve those milestones on time. So what about jumpers and walkers? So again, another very common question we get, and just some little interesting facts about jumping and standing. So children do not jump on their own until closer to 2 years old. So putting babies in jumpers really isn't the best idea at this point because we want to protect their hips. And we want to avoid prolonged periods of standing for infants until they're at least 7 months old. And again, that's to help protect their hip joints so that they can form and develop properly. And there is some research out there that shows that infant walkers are actually shown to delay independent walking because babies learn to rely on that support of the walker. So some alternatives to jumpers and walkers are if you are going to use a standing device like a walker or an exerciser, you want to adjust it so that the baby's feet can be flat on the floor and they're not standing all the way up on their tiptoes. That can lead to bad habits and cause them to walk on their toes when they're older. Another thing is that reminder of only using short durations of 15 to 20 maximum of a container use. And anytime you do use a container, promote as much floor time as possible to allow them to move freely, explore their environment. And again, that's going to help promote age-appropriate gross motor skills and improved motor planning. So here's some nice pictures. So on the left side of your screen, it shows what not to do. So you can see these children are all the way up on their tippy toes, or they're just sitting in the sling of the devices. And on the right-hand side, these are our alternatives. So if you are going to use a standing device, you want to make sure that the baby's feet can be flat on the floor. So if they're tall enough, you don't have to adjust it at all. But if the baby's not tall enough, you can raise the floor up to their feet by placing some books on the floor. That way their feet can be flat. Other alternatives are using a push toy, obviously promoting our floor time, and letting them pull up to stand on furniture such as a sturdy couch. So now we're going to get into what should my baby be able to do by each month. So at 1 month old, what we're looking for from a physical therapy standpoint is that the baby can focus on your face for brief periods of time. You may notice that they're moving their arms and legs randomly with varying speeds and intensities. They can calm when they're being held or talked to. They tolerate tummy time on your chest or lap for a few minutes at a time, and they may only briefly lift their head up to clear their airway. And that we want to make sure that they're moving both arms and legs symmetrically so that they're not favoring one side of their body. At 2 months old, what we're looking for is that they can focus on your face for 1 to 2 minutes at a time. They may begin to turn their head side to side to track objects or faces. They're starting to kick their legs and move their arms with more control. When they're on their tummy, they're lifting their head about 30 to 45 degrees off the surface, and they may start to bring their hands to their mouth or their face. At 3 months old, we are looking for them to start tracking faces and toys when they're moved up and down and side to side. They may start to bat or reach towards toys with more accuracy. They're starting to hold their head more steadily when you are supporting them against your chest. When placed on their bellies, they're lifting their head a little bit higher, so a little bit greater than 45 degrees when in tummy time. They may start even rolling from their backs to their sides, and they're starting to reach their hands towards their knees. What should my 4-month-old baby be able to do? So you may start noticing them rolling from their back to their belly or belly to their back. During a little chin tuck there, like that picture shows in the top left, they should be starting to get a chin tuck with a pull to sit. When they're on their belly, they're starting to press up on their forearms and lift their heads higher. And at this point, they should tolerate at least 60 to 90 minutes of tummy time a day. And again, that's broken into small bouts throughout the day. At 5 months old, we're looking for babies to roll from their back to their belly or belly to back. They're starting to sit up using their arms as props for short periods of time. When on their belly, they may start even pressing up on straighter arms, and they're starting to reach for toys when they're in a supported sitting position. And at 6-month-olds, we are seeing that they're starting to sit more independently for longer periods of time. They may still be a little wobbly at this point, and that's okay, but they're not having to rely on their hands as much to hold them up and sitting. They're gaining that nice trunk control. On their belly here, we should really see them pressing up on straight arms, and they should even start to pivot in a circle when on their bellies. So to go over some atypical behaviors and when you should talk to your pediatrician. So these are some red flags. If you're noticing your child doing any of these, this is a great opportunity to talk to your pediatrician. So if their head control is not improving, if by 3 to 4 months old, they cannot hold their head up pretty steadily, That's definitely something to bring up with the doctor. If they're favoring one side of their body, if you notice that they're always looking to one side more than the other or moving only one side of their body, as well as if you're noticing a head tilt, if they're holding their ear closer to one side of their shoulder, that could indicate a possible torticollis and that could warrant some physical therapy. If they're really resistive or not tolerating tummy time, and you've tried those tips and tricks like incline tummy time and chest to chest and over the boppy pillow, and they're still really fussy when you place them on their belly, it's definitely a good thing to bring up to the pediatrician. If when you pick them up or if you're changing their diaper, getting them dressed, if their arms or legs feel very stiff, or if they feel very floppy and loosey-goosey, that's something to bring up. If you feel like your baby has a flat spot on the back of their head from maybe favoring looking one way over the other, and if they're not starting to tuck their chin or hold their head up with a pull to sit. So what can you do to help in the meantime? So definitely when in doubt, talk to your pediatrician, but here's some tips and tricks. So again, play is best for your baby. So varying up, placing them on their back, on their sides, on their belly, and in a supported sitting position throughout the day when they're awake and alert can help promote those gross motor skills as well as prevent flat spots on the back of their head. If you notice that your child's preferring to look one way over the other, you want to place toys and objects on that opposite side to encourage them to look the other way, as well as having them visually follow toys side to side to help them track both ways. And again, if your baby's not tolerating tummy time, trying small bouts throughout the day to equal about 60 minutes a day by the time they're 4 months old. You can distract them by singing to them, talking to them, pulling out fun new toys, and try modifying that surface with incline tummy time if they're not tolerating that. And like I said, when in doubt, talk to your pediatrician if you have questions or if you wish for a physical therapy referral. We are more than happy to see your children and go over everything and answer any questions you may have. Okay, so that is the end of our physical therapy section. We will move on to occupational therapy with Liz.
So in occupational therapy, there's a lot of overlap with physical therapy when working with infants and young children. But today we're going to focus on the fine motor skills and feeding. The reason we call it occupational therapy is we all have occupations, and a child's occupation is to learn, play, and grow. OTs are there to help develop these skills needed to help in their occupations of play, so taking care of themselves, which is activities of daily living, and social interaction and participation. So we work with strengthening, reaching, grasping with their hands, interacting with toys, and visual tracking. We also work with infants who do have some sensory processing issues, feeding difficulties, and some fine motor delays. The following can interfere with the acquisition of on-target fine motor skills, self-care skills, and visual attention skills, including the muscle tone can be floppy or stiff. And I know we talked about it in the PT section. If they're hypersensitive or if they're too sensitive or not sensitive enough to hear when they hear things, look at things, feel things, taste things, or moving, that could be an indication there could be some sensory issues. And if they don't move their arms like they should, they don't move them enough or too much, and in their core area, and lacking some head control. And if they don't have eye contact, those would be areas in which they might not acquire their fine motor and visual motor skills. Next slide. So birth to 2 months, believe it or not, there's a lot that goes on in this early infancy period. Initially, the baby will hold their hands in a fist with their thumbs in their palms with random opening and closing. But by 2 months, their hands could be more open, sort of bringing them into their mouth area. They can look at faces at their center or called midline, and they can visually track toys from side to side, and they can start to do up and down as well. So toys and faces. So when the baby's having their bottle or nursing, they will automatically turn their head and make the sucking movements in response to a touch on the cheek or their lip, and that is an innate reflex that they have for survival. And then they will, at 2 months, they're getting more coordinated with their suck, swallow, and breathing patterns. Next, okay, good. At 3 to 4 months, the baby opens the thumbs out of the palm, but they're not doing a lot of grasping yet. They begin to grasp, and they're doing a lot of swiping motions at this time. They will by 4 months, they should be grasping a toy intentionally. They should be putting toys in their mouth and bringing a lot of toys up towards their mouth area. They can hold a rattle briefly when placed in the hand. And in supported sitting, they can follow objects and faces. They can become more playful during feeding. They start cooing at this age and smiling, and they may anticipate feeding on the side of the bottle or breast. They comfort with a lot of sucking, and they bring toys to their mouth, hands to their mouth, and may use a pacifier or thumb to calm. By 5 to 6 months, the baby begins to grasp little blocks and cubes. They're reaching across the center of their body, and they reach up to their parents. They might reach with one hand to grasp a toy or object, and they actually will shake a rattle at this age. They will put both hands on the bottle and try to hold the bottle, and they will begin to take baby food from a spoon. So a lot of times it would be starting with the cereal, and you would follow, and pureed foods. You would follow your pediatrician's recommendation on when to start actually doing pureed foods, and they will look. They will anticipate feeding on sight of the bottle, so they know what that bottle is for, and they anticipate that. Some red flags to talk about with your pediatrician would be not opening their hands or thumbs. They remain tucked in and the hands don't open, not reaching or holding toys, not swiping at toys, not giving you eye contact or visual tracking, using one hand over the other, one arm over the other, looking to one side more than the other, inability to self-soothe. So when given a toy or a pacifier, they're not able to calm themselves down. And even when you're walking around with them, they just are not able to really calm down. Not bringing their hands to mouth and toys to their mouth. Difficulty latching onto breast or bottle, that would be real early in their development that you would notice that. And difficulty gaining weight or managing food, that would be an indication to talk to your pediatrician. So what can you do to help? If they prefer one hand over the other, you were going to place toys on the opposite side, so they would hopefully reach over and grasp and look at the area. You're going to place toys in their hands to work on grasping. There's lots and lots of toys with different textures. Those are really good to place in their hands. Use brightly colored music or light up toys to work on visual tracking. If their hands are fisted, work on opening their hands to stretch. And the most important that, because a lot of development begins with when they're on their belly, is putting weight through their hands. Babies begin to rock from side to side and forward and backward during this 0 to 6-month time. And that is really, really important for their further fine motor development. Believe it or not, babies that are on their belly more have been shown to have better handwriting. So putting weight through those hands really is important. And pushing weight, that would include pushing weight up through the extended arms as well, and getting all the shoulder, all the muscles of the upper arm, shoulder, and hand working together. If you do have feeding concerns, you want to bring that up to your pediatrician right away. Sometimes it's a real easy fix for the feeding, and we do see some kiddos for just 1 or 2 sessions working on feeding. So sometimes it's just a quick fix, but you want to bring that up right away, and you want to give them lots and lots and lots of floor play. Can't emphasize enough how important tummy time is, and putting them on your belly and sitting, interacting with them is just so important. All right, and now we're going to move on to our speech and language pathologist, and she's going to bring up some good information about screen time.
So like Liz said, we'll start the speech information section about some facts about screen time. So by age 3 months, 40% of infants are watching screen media regularly, and 29% of babies under age 1 are watching TV and videos for an average of 90 minutes per day, while 23% have TV in their bedroom. 1 in 3 kids are using tablets or smartphones before they can talk, and preschool age children spend an average of 4 hours per day using screen media. And 8 to 10-year-olds spend nearly 8 hours a day with screen media, and teens spend more than 11 hours per day. And these are statistics from commercialfreechildhood.org and the American Academy of Pediatrics. So the American Academy of Pediatrics actually recommends 0 screen time for babies under age 2 years old. Yet by 1-year-old, 29% of babies are watching TV and videos for an average of 90 minutes per day. And we know that screen time can actually undermine learning for babies. 56% of parents of young children believe that baby videos are actually beneficial for development. So this presentation is not long enough to list all of the negative effects of babies and screen time, but here are just a few. It negatively impacts their sleep. It's a factor in childhood obesity. It can cause mental health deficits. It reduces play opportunities. It hinders interaction and language skills, and it may cause core strength or posture issues. It also impairs attention and increases impulsivity. So how does screen time actually hinder language? The main thing is that it limits face-to-face interactions with caregivers. So it limits the caregiver talking opportunities and baby listening opportunities. And babies learn to become passive learners instead of active explorers of their environment. It also limits their creative play opportunities and limits baby's opportunities to use all of her senses for whole body learning. We also know this about digitally distracted parents. Research shows that babies show stress and anxiety symptoms such as increased heart rate or increased cortisol levels when they are attempting to look at a caregiver and their caregiver is distracted by technology. So it goes back to visual preferences. Your baby really wants to look at your face and interact with you, and screen time limits that opportunity. So a feasible and fair recommendation for screen time. For every hour a child spends in front of a screen, he or she should have an equal amount of time spent in non-screen play. But this recommendation does not apply for babies and toddlers. We should be discouraging all screen time for babies and toddlers, and 0 hours of screen time is recommended for children under age 2. So in terms of speech and language, speech refers to the sounds that your child is making. As an infant, this would include cooing and babbling, which we'll talk a little bit more about in the next slides. Language refers how your child comprehends language, which is their receptive language, and how they use their language, which is their expressive language. So the comprehension of language would include understanding of cause and effect relationships, which could be something as simple as, I push this button and the toy lights up, or I push this toy in this direction and the music starts playing. Following directions, understanding vocabulary words, comprehending phrases or sentences used by communication partners. Their expressive language includes gestures, body language, vocalizations, words, sentence structure, the ability to answer questions. And their social emotional refers to how a child interacts with others. This includes joint attention, which is being able to attend to the same thing as another person. So if you as the caregiver point to something across the room, like there's a ball sitting on the floor, you point with your finger and you say ball, and your child turns their head and follows your point to see the ball, you're jointly attending to the same object. Greetings, play skills, and engaging with others. From birth to 3 months in terms of speech development, we expect babies to start making vowel sounds like ah, eh, and and to begin to make cooing sounds or happy noises. From birth to 3 months in terms of language, we expect babies to respond to loud noises, so usually that would be marked by a startle. Visually focusing on objects and may begin to follow a moving person with their eyes, glancing momentarily at a person who talks to him or her. And in terms of their expressive language, we expect them to express their feelings by cooing, gurgling, and crying, vocalizing to a caregiver's smile, and to express pleasure. And we expect to hear different kinds of crying differently for pain, when they're tired, or when they're hungry. From birth to 3 months in terms of their social emotional development, we expect babies to start attending to a speaker's mouth or eyes, smiling or cooing in response to another smile or voice, getting excited when a caregiver approaches, and making eye contact with the caregiver. And you can see in this picture on the side with the mother engaging with the baby. This is a great example of a way that you can engage with your baby when they're small like this, to help enhance their social emotional development. So getting face to face with them during times like diaper changes, or if they're on the floor playing in tummy time and they're flipping over just for a minute of respite, this is a good time to get face to face with them, sing songs, make silly faces, just talk to them, and that's great for their social emotional development. From 4 to 6 months in terms of speech, we expect babies to vocalize and self-initiated sound play, vocalize single syllables like ma or ma, try to repeat sounds heard in their environment, and this is when babbling begins. They experiment and play with sounds by yelling, gurgling, blowing raspberries and bubbles, and they vary volume, pitch, and rate. From 4 to 6 months in terms of their language, we expect them to turn their eyes or head to search for sounds, respond to voices by babbling, vocalize towards objects, laugh, say mama and dada without meaning. So when babies first start to say ma, and da, usually that is not a meaningful thing that they're saying. So they're not actually saying mama or dada. They're just making sounds with their mouths. Usually mama and dada meaningfully comes in between 9 and 12 months. They babble to gain attention, and they show pleasure or displeasure by vocalizing. From 4 to 6 months in terms of social emotional development, we expect babies to show excitement when a caregiver approaches, experiment with cause and effect play, and play actively when propped in play area for several minutes. So when should you talk to your pediatrician? The red flags in terms of speech would be not smiling or interacting with others or caregivers, not making sounds or beginning to babble. By 6 to 12 months, if your baby has poor eye contact, lack of gestures, not engaging in play, or not babbling, or if your child has been diagnosed with a congenital disability like a hearing loss or Down syndrome, discuss a referral to speech therapy with your doctor. So what can you do to help? Make sure that your child can hear. Did they pass their newborn hearing screening? Respond to your child and talk with them, engage in vocal play, work on imitating actions by playing games like peekaboo, singing nursery rhymes, the ones that have the gestures that are associated with it, so like Itsy Bitsy Spider, or if you're happy and you know it, clap your hands, and emphasize daily actions in your routines. Also talk about your day and work on environmental or animal sounds like a cow says moo, the car goes beep, or uh-oh, and read with your child daily. It's okay when you're reading to talk about the pictures as opposed to reading the story. So even if you're just pointing out one picture per page when your baby is little, just saying, oh, look, there's a cat, and then turn the page. Oh, look, a dog, turn the page. That's okay. You don't have to read every word that's on the page of a book. In terms of a good resource for books, Dolly Parton's Imagination Library is a great resource for families. So this is from birth to age 5, your child will receive a monthly delivery of a book that is specially selected for your child's age. And if this is something that you're interested in signing up for, you can go to the ohioimaginationlibrary.org and get those free monthly books delivered. This concludes the speech therapy section.
Okay. That concludes our presentation for Is This Typical Birth to 6 Months Old?